So today we're going to be checking the 12 cranial nerves. So there isn't a specific order in which these nerves can be checked and assessed, but we're going to do it in the way I learned it. So to start off, we want to do cranial nerve number 5, which is trigeminal nerve. The trigeminal nerve can be checked and assessed by touching the patient's equal sides at the same time. So we're going to touch from the forehead down to the cheeks at the same time and assess for equal sensation on both sides. So let's see. Feel that?
Yeah.
Is it equal on both sides?
Yeah.
Okay. So that's good. He passed that test. We're gonna go on to cranial nerve number 7, which is the facial nerve. So to assess the facial nerve, what we're gonna want is have the patient puff up their cheeks and then smile. And that's gonna give us any signs if there's anything wrong with cranial nerve number 7. So the next assessment actually includes 3 cranial nerves. So it's going to be cranial nerve number 3, 4, and 6. So that's going to be oculomotor, that's going to be trochlear, and that's going to be abducens nerve. So in order to check these 3 nerves, what we're going to do is we're going to want to get a pen, or you can do it with your finger as well, and ask the patient to look at the end of the pen, and we're going to assess for the 6 cardinal gazes. So without moving your head, I want you to follow my pen. Okay, so everything looks good on that front. So next we're going to check cranial nerve number 2, which is the optic nerve. So what I'm going to need you to do is take your glasses off, put one hand on one eye, and I'm going to want you to try to read that board.
A, B, C. Yeah, I can't read that.
So you ended off on the top. Alright, so put your hand on the other eye, and we're going to try again from the top.
A, B, C, D.
Okay.
Yeah.
So how about, okay, so actually before you put on your glasses, I want you to check if you can read with both eyes open.
A, B, C, D, E, F, G, I.
No, you're good.
No.
That's it. Okay, so that was the end of cranial nerve number 2, the optic. So what we had him do is look at the Snellen chart and see how far down he can get on the chart. So he didn't get very far on that, but that's due to him having poor eyesight and having glasses. So moving on to the next cranial nerve is cranial nerve number 8, which is the vestibulocochlear nerve, which is the nerve that we check. This is a whisper test. So what we want to do is we want to whisper on both sides of the ears and see if he can hear and understand what I'm saying. So we're going to start on this side. So say it out loud.
Blue.
Okay. We're going to go on this side.
1.
Okay, so he's good on both sides, good of hearing. So we're going to go on to cranial nerve number 1, which is the olfactory nerve. So for the olfactory nerve, what we want the patient to do is, close your eyes. So what we want to do is grab something that they can smell, preferably like, in a hospital setting or a clinical setting, a hospital alcohol prep pad. And we're going to ask him to see if he can smell the pad. Okay, so we're going to ask him, do you smell the pad yet?
No.
How about now?
Yeah.
Okay. So he's good on that front. You can open up your eyes. So we're going to go on to cranial nerve number 10 and 9. So there's 2 cranial nerves on this assessment, and that's the vagus and the glossopharyngeal nerve. So for these 2 nerves, what we want to check and assess is see if you can go ah, and then swallow. And you could also just use your eye and check to see if you can swallow, but if you also want to, you can put your fingers, both fingers, or just one finger, and see if you can feel him swallowing to assess that nerve. So moving on to the next nerve, which is cranial nerve number 12, is the hypoglossal nerve. So for this nerve, the assessment would be for him to stick out his tongue and then smile afterwards. So what we're gonna have you do is stick out your tongue and then smile. Okay, we're good on that front. So for the last nerve is cranial nerve number 11, which is the accessory nerve. So for this assessment, it's pretty easy. All we're gonna have our patient do is see if he can shrug. Should we just try to keep it up there? All right, good. So that's all the cranial nerves assessed, and that's the way I learned it in the order. You know, as I stated before at the beginning of the video, you don't have to do these in any specific order. There's no specific order in which you do these, but these are all the ways you assess each cranial nerve as I stated. So thank you. That's the end of the video.